All right, good afternoon, everybody. Oh, let's pretend like you actually like me. Let's try it again. Good afternoon, everybody. Yeah, by a show of hands, who's ready for happy hour? Excellent. I'm so excited here today. My name is Dan Lear. I'm with a group called Somebody to Talk To. We're a patient outreach and advocacy group, which I'm going to talk to you a little bit in a minute. But we're going to talk about the Rare Disease Playbook. I'm so excited about being here today. I'm excited for two reasons. First of all, it's always great to be in front of a group of people who are on a common mission. We're all here for the same reason in the rare disease journey, attempting to connect people and make things better. And I'm excited for that, and I'm very thankful for you. The other reason why I'm excited is I'm actually a rare disease patient. I have amyloidosis, and the movement and all the drug trials and all the new drugs that have come out in the last 3 or 4 years are absolutely incredible. So what's happening in the industry, the rare disease industry, is incredible. And I'm excited about that. So anyway, thank you guys for being here. Please put a round of applause together for all the things that you're doing. Thank you so much. I appreciate that. So today I'm going to talk to you about the Rare Disease Playbook, about some tools that can help us as rare disease advocates make things happen. This book we designed for patients, family caregivers, healthcare providers, business development teams, clinical research teams, hospital administrators, and health professionals. I'm going to share a little bit about myself and about our organization, and then outline a couple different chapters in the book that can help all of us in our business. Sound good? Yes or no? Awesome. This is an image of me years ago. This is after we won our second straight national championship in college basketball. The picture's not up there for the basketball achievements. It's about what it takes to get there. On a college basketball team, there's 14 scholarship athletes. As far as athleticism went, I was probably 8 or 9 on that team, but I was able to start for 2 straight years on a team that won 70 wins and 5 losses and won 2 straight national titles. How is that possible? And the answer is mindset. If you're taking notes, write this down. Mindset, attitude, and hustle make up for a lot of deficiencies. I'm going to repeat that. Mindset, attitude, and hustle make up for a lot of deficiencies. Little did I know that those tools that I was developing were going to help me in the rare disease world. After that, I went to spend 6 years with Tony Robbins. I was his right-hand man to help build his seminar division, where I learned more skills on personal development, changing behavior, improving outcomes. I was the #1 performer for Tony Robbins, and there's only one reason why that happened. Mindset, attitude, and hustle make up for a lot of deficiencies. When I left Tony Robbins, I started my speaking career in Las Vegas, and I became the #1 speaker in Las Vegas, the most requested speaker in Vegas, spoken over 30 countries. And during this time, I was starting to feel different in my body. My body was breaking down. I didn't know what was going on. I still used to play basketball, but I couldn't recover. So then I started doing spin class. Pretty soon I couldn't do that. And after that, I went to yoga, but I was passing out doing downward dogs. But nobody could tell me what was going on. I was seeing specialists for 2 years in Las Vegas. And as we all know in the rare disease world, early diagnosis is the key. But yet, so many people don't know what it is, and it's frustrating. So during this time, I had seen 3 different cardiologists, and they all told me the same thing. You've got congestive heart failure. You've got what's called athlete's heart, which is a thick heart. But that's amyloidosis, but they couldn't figure. It wasn't on the drop-down menu. One of the things that I'm so thankful for all of you in the rare disease world, is for the patients out there, the uncertainty that's happening trying to get diagnosed. There were many times during this time in my life where I didn't go to sleep at night because I didn't know if I was going to wake up. My heart was going crazy. Nobody could tell me what was going on with it. To tell you how bad it was, or what rare disease patients go through, one night it was just one of those nights and I wasn't able to sleep. So I said, screw it. I booked a flight from Vegas to Minneapolis and took a red eye, went to Minneapolis on a rental car, went to Rochester, and went to the emergency room at Mayo Clinic so I would be there. And I had a backpack because I was hoping I would stay and they would fix me. They thought I was crazy. They said, what are you doing here? I said, I don't know what's going on with my body. And they said, well, we've got good news for you. There's something definitely wrong with you, but you're not going to die tonight. So you can go home. And so I was excited about that, went home, and then I came back in 2 weeks and I got diagnosed with amyloidosis. I was sidelined. I didn't know what to do, new challenges, uncertainty, and the feeling that people have when they get diagnosed for the first time, what's going to happen next. And so there was these challenges. And so what happened was during this time, and one of the reasons I'm here, is I started making videos for my family. I started making YouTube videos so I wouldn't have to explain amyloidosis and the treatments. I was videotaping the physicians, the treatments, the drug trials, everything. And I was putting up on YouTube. And pretty soon I had amyloidosis patients from all over the world coming to my YouTube channel, and they would hit me up. And they would say, Dan, will you please talk to my uncle? You're the only person he would believe in. Dan, will you please talk to my mom? She just got diagnosed. You're the only person that she believes in. And why is that? It's because when I was making my videos about amyloidosis, I was optimistic. I was positive. I was talking about healing. I was talking about growing. I was talking about getting better. And people were attracted to that. If you're taking notes, write this down. 90% of your success in life is your mindset. 90% of success in your life and your business is your mindset. By a show of hands, how many people would agree with that statement? Absolutely true. The only reason I'm standing here today is because of my mindset. And so I didn't know that those tools were going to allow me to thrive in the rare disease business. So fast forward, I got contacted by our CEO and my partner, David Gusick. He runs Somebody to Talk To. He has other indications, other patient education programs, outreach programs that we do. You can see on the screen there's 3 different ones. The amyloidosis one is at the top. We also do Duchenne muscular dystrophy, and we also do sickle cell. And we're opening up many more indications this year. So I happen to run the amyloidosis outreach program. And so just last week, we had over 150 people on from all around the world. And our program is so unique because our participants get to talk to each other, compare notes, build relationships, and it's incredible. So this is our mission: to eliminate all barriers to professional and emotional support, including cost, stigma, and scheduling, to make high-quality, impactful, and emotional support accessible at no cost for every rare disease patient and family, regardless of their education, income, and access to medical professionals. Does that sound good? Yes or no? Yes or no? That's what it's all about. So this is, I'm going to talk about the rare disease playbook for a minute, some tools that we all can use to grow our business, because what I realized after doing 25 years of keynote talks and talking to industries all over the world is that what I'm going through today as a rare disease patient is the same tools that business people use to grow their business. So we created the Rare Disease Playbook because the rare disease market, we need to work together to make progress. And so the book is broken down into 5 different modules: mindset, strategy, teamwork, the big picture, and your next move. Now, in the essence of time, obviously, I'm just going to touch on a couple of the modules and just outline a couple chapters. So on one of the modules is called Mindset. The chapters are accepting losses, being coachable, repetition, and learning from mistakes, mastering fundamentals, and physical conditioning. Now, my question is, do all of those particular things apply to you in your business and life? Yes or no? Yes or no? Yeah, I mean, all of these things you can apply. So what I'm going to do is just look at the mastering fundamentals real quick, pull out some excerpts from the chapter. So mastering your fundamentals. If you skip the basics, you're going to break down under pressure. This holds true for anything in business and anything in life. If you're in a relationship right now and you skip the fundamentals, it's going to break down. In life, if you skip the fundamentals, it's going to break down. In your business, if you're skipping the fundamentals. What are my fundamentals as a patient? My fundamentals are eating well, making sure I'm getting my rest, taking my meds, being positive. Those are my fundamentals for success. What about a pharmaceutical rep? Everybody wants to make the big sale, but if you're not taking care of building trust or asking the right questions, you're never going to get to the sale. Fundamentals are important. It's not glamorous, it just wins games, and that's what it's all about. In our book, we have what's called our sideline strategy, which are questions that help you elicit some action steps towards success. So here's some questions for you today as you look at your business in the rare disease industry. What basics do I need to recommit to? What basics do I need to recommit to? Also, am I consistent or only when it's game day? What's game day for you? What's game day for me is maybe it's going to an appointment or maybe a clinical trial. I've got a pacemaker going in this Tuesday. That's game day for me. So am I positive on that day or am I positive all the days? Am I working on the fundamentals or just on that day? Do you know what emotional, logistical, and financial hurdles that your patients have in your disease? So I would hope, whatever your category is in your rare disease, that you understand your patients and what they go through emotionally, financially, and socially. So I've got amyloidosis, and obviously I've got a coronary connection, so I've got heart issues. So I have to deal with that all the time in my life as well as everything else. And so here we are, it's 5 o'clock in the afternoon, and I'm up here giving this talk, but I've got edema that goes down from not my ankles, my cankles, all the way up to my chest. So by the time I go to my room tonight, I'm going to be about an extra 10 pounds than I was when I started today. And it hurts like heck. But that's part of the journey, and that's part of the things I hope that you know about your rare disease patients. The next module I'm going to outline real quick is teamwork, because nobody wins alone. The power of team, building trust through wins and losses, and playing to strengths are the 3 chapters in that module. And here's the highlights, if you will. Nobody wins a championship alone. Nobody can do it alone. So we need all of each other to come together, to communicate, to teamwork, to help this rare disease move forward and help all these things we're talking about. As a patient, who is my team? Is it my care team, my outreach group, my family, my friends? Who's my team? As a pharmaceutical rep, you're not just a salesperson. You can elevate the game with your knowledge, your skills, and your ability to communicate. Great teams communicate. And the question is, are we communicating, and what can we do to get better? So here's some sideline strategies, questions for you today. Number 1, who are your core teammates right now? Think about your core teammates. Who are they right now on your team? Number 2, is there a missing role that I need to fill? Emotional, medical, or logistical? And number 3, am I showing up to be a good teammate to the people around me? That's very important. And by the way, I'm going to give you a free copy of this book at the end here today, so stay tuned. So I'd like to talk to you about somebody to talk to, the #1 patient outreach group in the country. And the reason why it's unique is that we have hundreds of people every single week. So the reason ours is so unique is our patients create a connection with one another, and they're able to build each other and help each other grow. This is just last week. We just had a call. We had about 150 people on from all over the world. Patients, caregivers, caretakers. It's incredible. And the reason why it's so unique is we have 50-minute sessions. That's 50 minutes. 15 minutes is with an expert, hematologist, oncologist, psychologist. 35 minutes is for patient interaction, discussion, questions, empowerment. So they feel connected. They're talking to each other. They're sharing stories. They're building camaraderie. And by the way, we all know that when patients are more positive, it impacts treatment in a positive way. So I'm going to read these 5 different bullet points here about our particular program. Weekly outreach with experts. 35-minute session is for questions, discussion, and connection, which is where all the magic really happens. Learning skills to improve quality of life, focused on mindset and what I call life improvement activities. That's a term that I have, life improvement activities. That could be how to get out of a slump, how to set smart goals for yourself, how to change your attitude, turn those around, not to mention all the experts that we have that come on every single week. It's a sense of community, connection, and empowerment. So that is the most important part about what we do, and I think all of you know that, is that when people feel connected, they have a better chance to heal. It improves rare disease journey and the impact of treatment. I am a walking, living proof of that right now. I know that positivity can help you heal. I know that there's studies out right now, and I'm sure all of you know that people who are more positive, optimistic, and are connected respond better to therapy. Are you aware of that? Yes or no? Yes or no? Absolutely. It's ridiculous not to have some kind of connection for patients. It also helps with the journey. I mean, when you're connected and you're optimistic and you're positive, not only does it improve the treatment, but it extends the life of the patient. So that's what we're all looking for. Better quality of life, number 1, and life extension, number 2. And that's the power of somebody to talk to. So for an example, just recently we had on Dr. Heather Landau. She's from Memorial Sloan Kettering. She comes on. She did 15 minutes. She's an oncologist, hematologist. She's incredible. And that's a screenshot from our Zoom. And then we open it up for questions and comments. So here's my question to the group today. Increased quality of life. Is that a positive thing, yes or no? Yes or no? How about no isolation? Is that positive, yes or no? Sense of optimism, positive, yes or no? Feeling of connection, is that positive, yes or no? Absolutely. And better adherence to medicine, is that positive, yes or no? These are the things that we're doing on a weekly basis for the rare disease community for many indications. I just happen to have amyloidosis, and I lead that group, but we have many, many others. So here's what we're looking for in this group. We're looking for partnerships with organizations. So if you have a patient organization, an advocacy group, or you're maybe a hospital or a clinic, we want to partner with you. We're partners with City of Hope, Cleveland Clinic, Boston Medical. They send all their amyloidosis patients to us because we do a great job of helping them stay positive and stay connected. So if you have a group like that, we're looking to connect with you. We're looking for pharmaceutical sponsors who support their patient communities. The people who, for instance, we work with all types of people who have obviously new drugs in the amyloidosis world, but we also do other rare diseases. So if you're in the pharmaceutical world, want to connect and create opportunities for your patients to succeed, we want to talk to you. Also, training opportunities for pharmaceutical sales teams on mindset, leadership, and increasing performance. That's what we're looking for. We want to help the whole community work better, work more effectively, and work smart. That is somebody to talk to. So this is it's the guy on the right. That's David. He's our CEO. He actually speaks tomorrow at 11 o'clock. Here, not here, but somewhere here. So look for him in your booth, if you will. And I would like to give you a free copy of the Rare Disease Playbook. So if you want to take out your phones real quick and you want to take a picture of that or download the book, that would be absolutely incredible. So, as we finish off today, I would like to share with you a quick exercise that I picked up from some of the top companies around the world that will allow us to go out to happy hour and have the most happy hour ever. Would you like to see it? Yes or no? Yes or no? Okay, everybody stand up for me, please. Go ahead, put down your stuff. All right. Okay, I'm kind of improvising here. All right. I'm looking for I'm looking for somebody positive and optimistic. Oh, yeah. Hi there. Vera, hi. How are you doing, Vera? You're amazing. Give you a round of applause for Vera. Come on up. Come on up, girl. Come on, will you help me? I won't hurt you, I promise.
Oh,
All right. Come on, you go first. All right.
hi, everyone.
Everybody, this is Vera. Do you have a rare disease?
I do not.
You do not. That's okay. Here we go. Everybody's going to put out their left hand just like this, including you, Vera. And on the count of 3, I'm going to ask you a question like, are we going to have a great year? And you're going to respond with a hand clap and say, yes. Let's give it a shot. Are we going to have a great year? Yes. Oh boy, Vera. On a scale of 0 to 10, 10 being the best, how would you rate our group on that clap?
We can do much
We
better.
can do so much better. Give them a number. What's the number?
I will say 3. Let's go
Woo! A 3.
up. Let's go up to
Go up. So we're going to see if we can get to maybe a 5, 6, 7, 8, maybe a 9 or a 10. I'm going to ask you a couple of quick questions. You're going to respond by saying yes. We're going to build up into a yes-type climax of yes, 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 and finish off by going, whoa, yes. Now, Vera, only the most self-confident and secure people can do this. Do I have that group here?
They are wonderful. I have no doubts.
All right, here we go. Are we going to have a great year? Yes. One best. Yes. I'm proud of. Yes. Service. Yes. 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 Whoa. Yes. Not bad for an improvise. Not bad at all. Give yourself a round of applause. Make sure you get a copy of the book. See us at the booth. I'll see you at happy hour. And remember, positivity wins. See you at the top.